Herpes simplex virus infections are among one of the most frequent viruses. The herpes simplex virus is categorized into two types, HSV-1 and HSV-2. Herpes virus type 1 causes oral herpes and mainly transmitted by oral to oral contact. Herpes virus type 2 is a sexually transmitted infection and it causes genital herpes. Type 1 or oral herpes is mostly asymptomatic, but symptoms can include painful blisters or open sores, ulcers, in or around the mouth, which is called cold sores. Before appearance of blisters, the infected person can have some sensations on the skin like tingling, itching or burning around their mouth. These symptoms can recur periodically, and the frequency varies from person to person. The gold standard for diagnosing HSV-1 infection is HSV-1 serology. Treatment: topical doxacanol, a saturated fatty alcohol, is safe and effective against oral herpes. It is approved by FDA. Also, the current recommendation is oral valacyclovir, 2 grams twice daily for 1 day. Effective antiviral medications include acyclovir and penciclovir. Famciclovir or valacyclovir, taken in pill form, can be effective using a single day. In immunocompromised patients, more aggressive treatment is needed. People with symptoms of oral herpes should avoid oral contact with others, including kissing, oral sex, sharing objects that touch saliva. It can be transmitted from oral or skin surfaces that appear normal. However, the greatest risk of transmission is when there are active sores. Symptoms of genital herpes. Genital herpes can be asymptomatic or have mild symptoms that go unrecognized. When symptoms occur, it characterized by one or more genital or anal blisters or ulcers. Additionally, symptoms of a new infection often include fever, body aches and swollen lymph nodes. After an initial episode, which can be severe, symptoms may recur. Genital herpes or type 2 herpes transmitted during sex through contact with genital or anal surfaces of someone infected with the virus. HSV-2 can be transmitted even if the skin looks normal and is often transmitted in the absence of symptoms. In case of genital herpes, primary infections with multiple ulcerating lesions will resolve after approximately 19 days, regardless of treatment interventions. Treatment: acyclovir 400 mg tablets orally, 3 times per day, for 7 to 10 days. Valacyclovir 500 mg, 2 times per day, for 7 to 10 days. In immunocompromised people, both herpes can have serious and severe symptoms, including meningoencephalitis. Brain inflammation. It can be fatal in case of both of herpes types. Such cases treatment can be aggressive and chronic. Epidemiology. Herpes virus type 1 is very common. It affects almost 67% of population. Herpes virus type 2 is less common. It affects 13% of world population.